Hello, Dr. Bakshi. You have some videos about breath clinic and a breath lab, and I heard you talking about sinus massage.
Mhm.
When I wake up in the morning, one of my nostril or sometimes both are clogged, and and even it remains clogged for a while. So my
Mhm.
question would be: is there anything that I can do to get relief from that?
Yeah, sure. There is something called nasal cycle. Now, nasal cycle is when normally one nostril is open and there's a little cycle, 2.5, 3 hours. Only one part of the nostril is open. Many times you feel now, for example, do it now. Inhale, close your nostril, one nostril. Inhale, exhale. Close the other nostril, open the other nostril. Inhale, exhale. Do you find a difference?
Yes, one nostril is easy to breathe, and another is little bit you need little bit force.
Now that's normal. Now in about 2 to 3 hours, if you do it, you may find out that it is reversed.
Uh-huh, okay.
Now, why is that? Because that's the nature's mechanism, nasal cycle. And the nasal cycle is done for a couple of reasons. One reason is that we want to make sure that both remain open, definitely for need, but the air has to be warmed up and also moisturized. Now, if was both were open, lot of air will go in, number one. So the warming time will be less.
Less.
All that entire portion goes. And the second part is the moisture. So it is traveling up this way. It has to do those two things. Now, and also whatever is the secretion in the nose that gets dried up. So in order that we don't dry up both sides of the nose, nature has created this cycle. So that's called nasal cycle. Now, when we breathe, when you have clogged up nose, it's very likely that what happens is one of the nostril is not open, and even the sinus. Sometimes people have sinus heaviness or something on the face. Sometimes that happens. Do you have heaviness of one side or anything like that when you have clogged nose?
Uh, I think I have observed that. Yes.
Yeah. So this is an interesting part, and some people have that, some people don't have to have it. I'm just asking you because this is a normal phenomenon. It's not abnormal to people have one side blocked in the morning. It's not normal. I mean, you don't have to have cough or cold in order to have that happen. I just want you to know that. Now you can have it more if you have cough or cold. So now what do we do? Now, a couple of things we want to do. I'll show you one technique right now, and that is you close both nostrils. First, take a deep breath. Close both nostrils. Wait, let me show you first, okay? Let me show you. Then you can do it. I've closed the both nostrils. Take a deep breath, and then try to exhale. Keep the mouth shut and try to exhale. Go ahead.
It's,
Now,
it's difficult to exhale, and gets pressure in the ear.
right. What I want you to notice is go ahead, do this. Inhale, one nostril. Exhale. Inhale. Exhale. What's happening? Both are equal or unequal?
I didn't see much difference.
You just blew it, right? You just blew against that. So let's do this again one more time. This time you close the nostril and blow, and then you compare if you can have both are equal. Okay, let's inhale, close the nostril, blow a little bit. Open up and inhale. How does that feel?
Yeah, I feel both sides equal. I feel both sides equal.
Both sides are open, feel easier.
Right.
This is unblocking of them. You asked me the first question about unblocking. You can do this maneuver to unblock it. Okay, that increases the whole pressure, and it opens up the nose, and also opens up. It also creates nitric oxide, because when you breathe against pressure, it creates some nitric oxide. So now let's do the sinus massage. And in these are sinuses. There, one sinus is the maxillary sinus. Then comes the sinuses like along these nose and inside small ones, and the frontal sinus here. And then the deep one is called an ethmoid sinus, which is somewhere in the center of the, in the skull there, deep. So let's do the sinus massage. Both sides first.
So it's done in both the direction.
Yeah, both directions circularly. You can tap a little bit one side. So now what we want to do is close one side and bend your head and tap and massage. The sinus, the opening comes here into the nose. So when you bend it, now take a deep breath through this nostril. Feel where it's going. Very likely you may feel air going on this side.
Same side, right? Same side.
Inhale again. Exhale. Now let's change it. Tap this side, massage. Inhale. Feel the inhalation going from the nostril. Where is it going? It's going on this side.
Same side, right? It's on the same side of the north.
So maxillary sinus, you can open up this way. Now when you tap, it makes it vibration. Remember the vibration that we create? When you create the vibrations, it knocks off a little bit of fluid, and air also moves around. So let's do the massage here along the nose. Right up along the nose, and just underneath this part here, underneath this nose here, up like this, my fingers, see? That's the floor of the frontal sinus. We call it a frontal sinus. Right here. If you turn your fingers up like this and do, this is a very nice way to massage the frontal sinus. Then here in the front here, you can tap, and then tap all along here. Vibrations will vibrate through the sinus. Wherever you tap, the vibrations will go into that area in the air sac. So you do here, deep, it will go to the sphenoid sinus, it's called. So when you tap hard, the vibrations will go inside and knock off all the little things in the air sinus will open up. So this is the sinus massage we do to open the whole area. Now breathe.
Yeah, whole area is open now. It's like a clean, and it's open area. Everything, like, you can breathe it so nicely. Feel good.
So sinus massaging always helps, because there are nerves go from here inside, and the nerves also conduct a little bit of vibrations when you massage. You can tap also. So this is the sinus massage, and sinus massage is used for people who have sinus situation, infection, or even keep it open. Keep it open. Now, if you do it on a daily basis, regular in the morning, you will see a lot more of improvement in your breathing. You'll see a lot more of improvement in the air quality, and also both sides will open up, and you'll get enough air. Now, will it go back to the nasal cycle? Yeah, it will go back to the nasal cycle after some time. But for the time that time you will have, how do you feel energy wise?
I'm feeling good. I'm feeling energetic.
Energetic, and it because the nitric oxide does a wonderful thing. It opens up the airways, it opens up the blood vessels flow, and you actually feel, I sometimes feel warm in this area. Your face feels warm and everything,
Okay.
Okay.
Can this massage be done like during the daytime or just in the morning?
Anytime you want to do it. Anytime you do it, anytime you feel like doing, make sure that the hands are washed.
Okay.
I mean, touching somewhere, but yeah, anytime you can do it. This is not it doesn't have to be a certain schedule, because ultimately you can get more air, cleaner air, good advantages of nasal, massage. And you want to feel fresh, particularly when you've been working hard during the office or things like that, and you want to feel fresh in the face. You can
Yeah,
do
so
it.
I think so. So it helps in relaxing also.
Yes, absolutely. It relaxes, it energizes as well as it relaxes. Both things happen.
Okay, good. So great. Sinus massage looks like it's a wonderful tool for any sinus related issues,
Yes, absolutely.
and
And mm,
it's very easy to practice. It's very easy to practice, and
yeah.
got so many benefits.
Sure.
So thank you, Dr. Bakshi.